Okay, so ma'am, we are live now. So good morning to all dear esteemed guests and valued participants. I warmly welcome each one of you for today's webinar. I am Dr. Sanjay Nagdev, and we have come together virtually to explore and discuss the webinar Pharmacist, a proactive positive care in rational therapeutics. It's our 27th webinar being sciences and research under the mentorship of Dr. Shashi Alok Sir, National President, Society of Pharmaceutical Sciences and Research. Our aim is to ensure healthy lives and promote well-being for all at all the stages. An objective of our society is to hold the consensus for promoting the causes of profession of pharmacy, to contribute to programs and services that emphasize the health needs of India and prevention of diseases, to honor the eminent pharmacists engaged in the engagement of pharmacy profession, and to promote and facilitate the acquisition, dissemination, and exchange of pharmacy knowledge and information about the practice of pharmacy and pharmaceutical services. Throughout this event, we are honored to have an incredible speaker, Mr. Rakesh Kumar Dixit, sir, Professor of Pharmacology and Therapeutics from King George's Medical University, Lucknow, Uttar Pradesh, as our distinguished speaker for today's webinar. And we are also joined by our respected Mrs. Monica Sabarwal, ma'am, convener, National Secretary of SPSR and Managing Editor, International Journal of Pharmaceutical Sciences and Research and International Journal of Pharmacy. We all are here to help and guide during the webinar. Rational therapy refers to appropriate, correct, and optimized use of medicine to achieve the best possible outcomes in terms of patient health and well-being. It involves the selection of most appropriate medicines at doses that meet the individual patient's need for an adequate period of time and at the lowest cost to them and their community. Pharmacists, as medication expert, play a crucial role in rational therapeutics, and they often, yes, the final checkpoint before a medication reaches a patient, making them a vital part of healthcare system. Their role has evolved from merely dispensing medication to being an integral part of healthcare system involved in patient care. In this webinar, the focus will be on how pharmacists can be proactive and positive players in rational therapeutics. And this will involve several aspects like patient education, medication review management, collaboration with other healthcare professionals, advocacy of rational drug use, research, and continuous learning. And without taking too much time, I would like to request Mrs. Monica Sabarwal, ma'am, to welcome our guest speaker, Professor Rakesh Kumar Dixit, sir, for sharing his experience, expertise, and knowledge on the topic. Over to you, Monica, ma'am.
Thank you so much, Dr. Sanjay Nagdev. A very good morning to all of you. Today, we are here. Today, I extend my warm welcome to each and every one of you. I am deeply honored to convene the 27th edition of the SPSR webinar, and even that has served as a platform for exchange of knowledge, ideas, and experience in the field of pharmacy and therapeutics. Today, we are gathered here virtually from over 25 countries with more than 3,000 registered participants. This overwhelming response is a testament to the global commitment towards enhancing the role of pharmacists in the national therapeutics. It is clear indication that we recognize this importance of this topic in the current healthcare landscape. Our speaker for today's webinar is a distinguished figure in the field of pharmacology and therapeutics, Professor Rakesh Dixit. He is a professor at the King George's Medical University, Lucknow, Uttar Pradesh, India. And his contribution in the field have been both significant and impactful. Professor Dixit's knowledge and experience and the dedication to his team make him an ideal speaker for today's discussion on proactive and positive role of pharmacists in the national therapeutics. The role of pharmacists have evolved significantly over the years, from dispensing medications to now being the integral part of the healthcare team. Pharmacists have a crucial role in ensuring the safe and effective use of medications. Today, we delve into this topic, exploring how pharmacists can be proactive and positive players in international therapeutics. As we embark on this intellectual journey today, let us remember that our collective goal is to enhance patient care and the health outcomes. Let us use this platform to learn, to question, and to grow so that we may apply this knowledge in the respective practices and contribute to the healthcare globally. Before we begin, I would like to express my heartfelt gratitude to the SPSR National President, Dr. Pradeep Golani, Dr. Sanjay Nagdev, the co-convener of this webinar, and the dedicated team behind the scenes, whose hard work and dedication have made this webinar possible. I would like to extend my heartfelt thanks to all of you for your participation. Your presence and engagement are what make these webinars successful and meaningful. Once again, I welcome to the 27th SPSR webinar. I am confident that today's discussion will be insightful, thought-provoking, and will pave the way of future advancement in our field. Thank you for your participation. I would like to forward this the fruitful and engaging discussion. Let's have a warm virtual welcome to the Professor Dixit. Over to you, sir.
Yes. Thank you, ma'am. Now, I would request Dr. Pradeep Golani, sir, to introduce our esteemed speaker, Professor R.K. Dixit, sir, with their brief profile.
Thank you so much, Dr. Sanjay Nagdev, sir. So, good morning, ladies and gentlemen, esteemed participants. It is with great pleasure that I, Dr. Pradeep Golani, introduce our distinguished speaker for today's enlightening webinar titled Pharmacist, a Proactive Positive Player in Rational Therapeutics. Dr. Rakesh Kumar Dixit, a prominent figure in the field of medical education and pharmacology, will be sharing his profound insights and expertise with us. Dr. Rakesh Kumar Dixit is currently serving as a professor in the Department of Pharmacology and Therapeutics at King George's Medical University in Lucknow. He brings with him a wealth of knowledge and experience that has shaped the medical and academic landscape. Dr. Dixit's academic journey is marked by excellence. He obtained his MD degree from GSVM Medical College, Kanpur, and his MBBS degree from the same institution. With a commitment to lifelong learning and professional development, Dr. Dixit has attended an impressive 204 training courses, CMEs, and conferences. His contributions extend beyond personal growth to mentoring the next generation of medical professionals. He has supervised 64 MD theses and projects and served as the chief and co-supervisor for 6 PhD candidates. Additionally, his active involvement in research is evident through the completion of 4 research projects, the publication of 5 books, 63 review articles, and 134 original research articles. Dr. Dixit's research has not only contributed to the academic world, but has also made a meaningful impact in the field as reflected in his total citations of 513, an H index and I-10 index of 11 each, and 2 copyrighted works. His dedication to the advancement of medical knowledge extends to his involvement in numerous professional organizations, including the Indian Pharmacological Society, British Pharmacological Society, and the National Academy of Medical Sciences, India, amongst others. Furthermore, Dr. Dixit's commitment to ethical medical practices and rational therapeutics is commendable. He is a life member of the Indian Society for Rational Pharmacotherapeutics, reflecting his dedication to evidence-based medicine. In recognition of his outstanding contributions to the medical community, Dr. Dixit has received numerous awards and appreciations throughout his career. Notably, he has been honored with the Best Teacher Award in the medical faculty at KGMU, Lucknow, in both 2020 and 2022. His dedication has also earned him with C.L. Malhotra Award for the Best Paper from the Association of Physiologists and Pharmacologists of India in 2010. It is our great pleasure to have more than 3,000 registered participants across the world. It's across 25 countries. Our maximum participants are from India, Nigeria, Saudi Arabia, Indonesia, Pakistan, Malaysia, Saudi Arabia, United Arab Emirates, Iraq, Romania, Ukraine, Qatar, Algeria, Myanmar, Macau, Australia, Tanzania, Mexico, and Syria. We are overwhelmed to express gratitude for their participation. Thank you all for joining us today. I encourage all participants to actively engage in the discussion, ask questions, and share your experience and knowledge. We are privileged to have Dr. Rakesh Kumar Dixit as our speaker today, and we eagerly anticipate his valuable insights on the role of pharmacists in rational therapeutics. Please join me in extending a warm welcome to Dr. Dixit as he guides us through this enlightening session. Sir, I request you to share your presentation and please stop.
Sir, please unmute.
Hello. Hello. Dr. Sasi,
Yes, sir. We are getting your voice, sir.
is it visible?
Yes, sir. It is visible, sir.
Okay. So first of all, I thank from the core of my heart to the Professor Sasi, Dr. Sanjay, Professor Pradeep, and Professor Monica for giving me the chance and inviting me to share my thoughts related to the role of the pharmacist as a proactive, positive player in current rational therapeutics. So when Dr. Sasi actually contacted me and asked to say something and to take a lecture in purview of the World Pharmacist Day, which is tomorrow, I suppose to be, and then I thought that this will be the best that if I take a lecture of the role of pharmacist related to the rational therapeutics, because that will actually align with the theme of this particular World Pharmacist Day. So once again, a warm welcome from Lucknow, a very good morning and namaste from Lucknow, India. So first thing is that I will go with some little bit interaction, but unfortunately we cannot interact in the online. So what we'll do, I'll just have a pause. When I will put some query, then I will have a pause, and then I'll give the answer also, and so that it would look like that we are interacting. So the query is, what is most important in this figure? There is an enemy, there is an army, there is a river flowing here. Army is here, enemy is on the across the river is there. Now how the army will win? So it is just a representation that we have a disease, we have a patient, we have a doctor, we have a drug, but unfortunately, neither the doctor nor the drug is going to treat the disease or the patient, benefit the patient. The reason is there is a river. So what is the most crucial part? The river is to be bridged, and this bridge is by pharmacists, nursing, paramedicals. So this is the beauty of the pharmacist, and this is how the pharmacist's importance in the rational therapeutics comes. So since beginning, I am giving the importance that pharmacists, without nursing, without paramedical, the doctors and drugs, they are just like you have army, but you cannot approach towards the disease or towards the patient. So do we need this CME? Yes, we need, because it is important for the pharmacist to know their importance. It is important for the clinician to know the importance of the pharmacist, for the patient to know the importance of the pharmacist, and everyone who is involved in the therapeutics, maybe patient attendant, anyone. And because we have to take risk and benefit assessment, so every time we have to go with the wiseness. So once again, congratulations to you all for the World Pharmacist Day. The theme itself is a very crucial one, and that is the pharmacist and the pharmacist is strengthening the healthcare system. And on this alignment, I took actually the topic. So salute to the pharmacists across the country, across the globe. We in India are more important related to the knowledge of the pharmacy, pharmacist, knowledge of the variation. The reason is that India is a country which is amalgamation of the multiple countries. So here we have variety of genetic variation, variety of race variation, variety of everything, whatever you can think, the variety in India it is present. So one doesn't fit in India, and therefore the application of the common sense, application of the knowledge, application of the wisdom, and application of the science for the treatment of the patient, for the prescription writing, for the dispensing, everything that becomes very important. So if we are having a high potential because we are a hub of new drug development. Also, the availability of the new drug becomes very easily in India, and therefore, if the drugs are being become available very easily in any place of the country. Now, the wiseness or the precautions they actually need to be highlighted more. And we actually are having highest number of the pharmacies at any sector. So need of the rational therapy training and importance of the pharmacist in the rational therapeutics becomes very pertinent. So now this quotation I will every time put, like need of the rational therapy training and importance of the pharmacist in rational therapeutics. So most of the slides they will be highlighted at the end by this quote, so that this is just an emphasis that how much the importance the pharmacists they have in therapeutics. So a very high chance of rational therapeutics are everywhere, and not only in developing countries. Most developed countries they also suffer with the same. And because of this, again I told you that I will highlight there is importance of pharmacists in the rational therapeutics. So wrong therapeutics can lead to the ineffective and unsafe treatment, increase and unwanted outcomes, ultimately leading to the higher cost, more harm, prolongation of the illness, and most important is the overall burden over the society and the country. If we want to have all these to be checked, now we have to go with the rational. And that's why, again, the importance of the pharmacist in the rational therapeutics. So wrong therapeutics may lead to the legal problems, bad examples, mistrust in the doctor and patient, pharmacist and doctor, pharmacist and patient, all these. Higher rate of the conflicts, salesmanship. So they think that either the doctor is promoting that particular brand or pharmacist is promoting. So that actually when the trust becomes mistrust, then lots of confusion may occur, and whatever being not there, they can be predicted. So again, there is importance of the pharmacist in the rational therapeutics. So changing existing therapeutic habit is very difficult. So better we have to not build the bad habit and then kill the bad habit, because killing the bad habit is very difficult. So better is not to develop the bad habit. So we will start with the good habits itself in the beginning. So my discussion will flow like introduction to the rational therapeutics terminologies. Why do we need this rational therapeutic workshop or CME component of the rational therapeutics, barriers, solution, and role of the pharmacist in the rational therapeutics, and some of the key messages and your inputs. So just a minute, I will pause and I'll say that just see this and tell. So because you can't tell, so I will tell that you might have thought school, but it is not a school, it is misspelled. This is just to make you awaken, so that you become aware of all become aware of, and because today is Sunday, so most of us are in the drowsy state. Now, second is let's eat grandma versus let's eat grandma. There is a slightly difference but the meaning is entirely changed. That message is that whenever, as a pharmacist, you communicate to any message to the patient or the attendant, please be very precise, because your one comma can actually lead to the misinterpretation by the patient. So that is how the I start. So name a thing, procedure, place, person which is without risk. In my knowledge, I have not found till now anything which is without risk. Maybe he is traveling or maybe he is marrying. I am taking lecture with a lot of risk. So every time, but I think that the risk involved is lesser than the benefit shared by all of us. So that's why I am proceeding. So the basic fundamental of the life is that if the risk is more, stop. If the risk is less, benefit is more, then you proceed. And that is how every time, maybe doctor, maybe pharmacist, maybe nursing, maybe anyone who is involved, first he or she has to assess the risk benefit ratio. If the risk involved is more, you stop, recheck, reconfirm to the doctor. Maybe he may be wrong, he may have given something with wrong interpretation, or you have misinterpreted wrongly. And if risk is more, please stop, reconfirm, then only proceed. So risk benefit ratio becomes the most important part of the therapeutic, and that is rational therapeutics. And because we have to assess the risk benefit, so here also the importance of the pharmacist in the rational therapeutics comes. One size doesn't fit all. Every individual is individual and we need individualized therapy. So individuals are to be treated as individual, not on a journal. So, and here the role of the pharmacist and other persons, the other paramedical and all, that becomes very crucial, because if the doses found which are written in the prescription sometimes may not be appropriate to the patient condition, then the pharmacist has a duty, pharmacist has a responsibility to reconfirm, recheck, and then before giving or before providing that particular treatment. So, because any bad news actually spreads very rapidly. So you can see galat dawa dene, so there may be wrong prescription, there may be wrong dispensing anything, and galat dawa dene se mareej ki maut or medical store. So medical store, that is pharmacist and all, they also get entrapped within these type of issues. And I have already told you that it is not in developing country, it is the most developed country which is also suffering with the same issue. So Indian government is very pertinent to reduce this irrational drug, fake drugs, irrational prescription and all. And because of this, your society is also concerned with this, and because of this, you have actually planned this particular CME. So better to have a correction beforehand rather to have a mistake and followed by the correction. All these, they lead that around 3/3 cause of death is because of the either medical error directly or indirectly or in any form. So medicine kills every third person, either directly or something indirectly. So if it is directly, it cannot be justified. It cannot be acceptable. So that is how we have to be correct. And we have to correct it as a team. A doctor, a perfect doctor cannot correct. A perfect nurse cannot correct. A perfect pharmacist cannot correct. So only thing is that we have to collaborate and we have to act in a rational way to get the rational therapeutics throughout the world. Otherwise, we can imagine the scenarios. So managing drug supply. So there is one wonderful book edited by Jonathan D. Quick, approved by the WHO, that is Managing Drug Supply. And this, if you read, now he has actually assessed lots of, and out of these three, I have taken the India, Pakistan, Bangladesh. If you see these, these three countries, the overuse, underuse, or misuse of the drugs, especially the antimicrobials, all they are, and injections, there is a very high degree. And that is how around, we can imagine the 50 to 60% of the medicines are injections. They are actually given unnecessarily or without any rational explanation. And these three countries almost they mimic in the similar role. Only thing is that India is little bit lesser in injection, whereas the Pakistan and Bangladesh almost same. So that's how we can think that India, Pakistan, Bangladesh, and all these developing countries, they are actually suffering with the overuse of the drugs, and especially the misuse and overuse of the antimicrobials and injections. These two are very, very important in the developing countries. So if you see here, about 55% of the patients they receive injection, out of which around 90% they can be treated by the other route also. So oral route was there, but unnecessarily they were forced to take injection. 30 to 60% of the PSC patients receive antibiotic. No need of antibiotics in simple viral fever, flu fever. But unfortunately, the trend is that no fever is treated without ceftriaxone. That's how some of the jokes also they were there. The ceftriaxone is not the drug of fever. So again, everybody should be aware of all this rationality. And if you see here, the doctor when prescribes must be very concise, very precise, and otherwise, what happens? The long list of medicine through the prescription that goes to the pharmacist. If the pharmacist is trained, if the pharmacist is rational, if the pharmacist knows the pharmacology and therapeutics and drugs, then he has right to reconsult with the doctor whether these drugs are actually needed or not. So every time my request is, if you get any prescription and your wiseness, your wisdom, your knowledge, your science is actually suggesting that there are 3 drugs which are unnecessarily written, or these 3 drugs they are wrongly written, or these drugs are actually having interaction which may lead to the fatal consequences. So better stop your dispensing, stop the further. First, let it should be sorted out with the doctor and the treating physician. So that's how we have to make our pharmacists very knowledgeable, sound, who have sound scientific knowledge, and especially the basic knowledge of the science related to each and every drug. Because most often the clinicians during the clinical practice, they actually sometimes either they become they forget, or because sometimes the things become in reflex. So when the things become in reflex, so you actually forget the primary learning. So that's how the pharmacist role becomes very pertinent. Otherwise, the patient, ultimately sufferer is the patient. So my message is to everyone that drive left if you are in India, but prescribe right. And what is right, I will tell. So, and dispense extreme right means you have to be more precise while dispensing and giving the medicine, because prescription is not guaranteed that the patient has taken. The prescription is not guaranteed that the patient will take. The prescription is not guaranteed that the drug will enter into the body. But once dispensing is there, now it gives more guarantee that it will enter into the body. And ultimately, whether the adverse effect or the side effect or the good effect, whatever they are expected, they will happen. So only thing is that irrational and irrational can be just divided by the presence and absence of the rights. So presence of right gives the Mr. Right, and Mr. Right will actually give the always rational prescription, rational dispensing everything, whereas the absence of the this Mr. Right will lead to the irrational prescription, irrational dispensing, irrational administration. So that is how, what is irrational prescription? That is failed to confirm the good standard of the treatment. Whenever the standard treatment is not followed, and abruptly something else is going on, which is not explainable by anything. Now that becomes irrational. It may be in the form of under-prescribing, it may be in the form of over-prescribing, incorrect, extravagant prescribing. When the disease can be managed by the 10 rupees cost, if it is managed by the 100 rupees cost, now this is not ethically, rationally correct. And here also the in part very important role of the pharmacist comes, because pharmacists are well aware of the prices, well aware of the cost of the medicine. Physicians, they write, but sometimes they don't know what is actual cost of the medicine, what is actual cost of this particular drug. So here the pharmacists, they can, by the discussion, they can rectify the issues, and they can lead, they can give the lead to the, they can guide, they can give the lead to the doctors to prevent the extravagant prescribing. And here again, the importance role of the pharmacist. So under prescribing, we are allopathic physicians, so naturally we don't prescribe homeopathic, but unfortunately sometimes the medicines, either because of the misinterpretation or because of the other causes, the drugs are given in a homeopathic dose, means less dose. Now less dose is again irrational, and here also over prescribing, that is, the medicine may be because over in the dose, number of the drugs are more, or it is the duration is too long. Suppose a drug has to be stopped within 1 week. Now, if the drug is not stopped in 1 week, it is continuing for 1 month. Now, naturally, the sufferer will be the patient. Now, by whose mistake he is taking 1 month? Because he never went to review his condition to the doctor. So, doctor wrote 1 week treatment. That parcha was with the patient. He got benefited. So naturally he continued the treatment. And because that drug was to be stopped after 1 week, but he did not. What was the fault of the pharmacist? The pharmacist must have most likely that person must have taken the drug from the same pharmacist. So pharmacist must have that much knowledge that this drug is usually prescribed for 7 days. If it is for more than 7 days, naturally the re-prescription should be there. And then don't dispense a drug without re-prescription. If the prescription is for 7 days, please, because this is very important, the over smartness of the patients, that produces harm to them only, because they over smartly don't go to review the condition. If they get benefit, they keep that parcha and continue the treatment. Now that continuation of the treatment ultimately leads to the number of adverse effects and number of diseases, new diseases. So here the role of the pharmacist is that, please, if the prescription has not been reviewed and revised and again prescribed by the physician, it has to be stopped, denied, so that the patient gets the right and the best advice. Otherwise, they will continue to take the drug without any indication. Incorrect prescribing can be corrected by the pharmacist, because pharmacists have enough knowledge regarding the interaction, regarding the basic pharmacology. And I have already told you that when the clinicians, they actually start practicing, so most often that becomes in the reflex. So when anything becomes reflex, the basics, they are actually forgotten or ignored. So sometimes you can pick up and this interaction is not acceptable in this particular patient. Maybe acceptable in the normal young adult, but may not be acceptable in the elderly. So that's how we have to be very much cautious. So fail to recognize that I can do most important thing. Then extravagant prescribing, I have already told you. So WHO actually tells that most important irrational prescribing is because of the excessive injections, multiple drug prescription, and excessive antibiotics and health tonic. So these are that formula I have framed that if the TINA is present without invitation, so just you remember this formula. If TINA is present without invitation, that prescription is irrational. What is TINA? The drugs with the trade name and tonics. What injections? If rational, then it's okay. Nutritional supplement. If rational, it's okay. Otherwise, not. And antibiotics. So these are, because most of the time you will see all these 4 categories, 5 categories which are prescribed. And if you cannot find the rational, then most often they become irrational. So TINA presence without invitation is irrational in simple terms. So types of irrational use of maybe right from the diagnosis to the prescription, and ultimately even the prescription may be right, but unfortunately sometimes the dispensing may become irrational. So there are multiple factors which are involved. Irrational prescribing is a global concern, and about 50 to 60% of the medication either they are prescribed irrationally. Indiscriminate and frequent use of the antibiotics and use of Hello, Dr. Sasi. Hello.
Yes, sir. We are getting your voice. You can continue, sir.
You are getting my voice?
Yes, sir. It's okay, sir. Yes.
Okay. So irrational prescription is a global problem, and I have already given a brief introduction of all these. And whenever standard treatment guidelines are not followed by any prescriber or any institution, now it is going to lead to the irrational therapy or irrational pharmacotherapy. So some of the terms are like rational. Why? When you call rational, when you can actually give the reason, when you can give the logic, when you can give that this is because of this, this is going to produce this, and this is needed, and then it becomes rational. Otherwise, not. Therapeutics is inclined to serve maybe in the form of any, and what is prescription? It is nothing but instructions, and these instructions not are related to the medicine only. It is related to the other like diet and all. So quality of prescription is a major determinant of how the pharmacist will give the medicine, how the staff will give the medicine, how the patient uses the medicine, and ultimately outcome of the therapeutics. So appropriate use of the medicine can contribute immensely to reduce global morbidity and mortality. And we have to do the optimization and improving the quality of the healthcare by utilizing the rational therapeutics, by the teamwork. The irrational therapeutics can be because of the busy doctor, overcrowding, and all these. We all know that these may be the cause, but one of the cause may be which need to be corrected is the training of the qualified pharmacist also. Because ultimately, I told you that writing a prescription is not a guarantee that the patient is going to take that. But once it is dispensed, now it is most likely that the patient will take. So ultimately, as you are nearer to that particular point, then the guarantee becomes more. So pharmacists are nearer to that patients, and because of that, ultimately, if they dispense, the chances are there that the medicine will be taken by the patients. And here the role of the pharmacist becomes very important, because if they see that the irrational FDCs, polypharmacy, irrational prescription of the injections and all these they have been given, then naturally they have a right they have a right and moral duty not to dispense. So determinant of the rational therapeutics, others are like lack of drug information, mistakes by the dispenser, I have told, poor communication and other things. So I'll go with the little bit fast from here. So if you see here, the drug-related complexity, complex regimen, cost of the regimen, all these, they actually lead to the overall rationality of the therapeutics. So, and that can be checked at multiple levels, right from the physician to the pharmacist and to the other persons. So dispenser, if has good training, the chance of the rational prescriptions are rational therapeutics are very high. Naturally, the patient load is in our country and other developing countries is very high. So naturally, the pharmacists are also overloaded and overburdened, and they have less time to communicate with the patient. That becomes a limiting factor for towards the rational therapeutics. Started with the material and started with the other facilities and lack of the supervision. Most often, especially in the periphery, the pharmacists are the pharmacy shops. They are not supervised by the qualified pharmacists. So ultimately, what happens? The unqualified person is sitting in the shop in place of qualified pharmacist, dispensing the drug at the risk of patient's life. That habit to be discouraged, and that has to be actually banned. Extremely 100% banned, because the pharmacists are the persons who are well qualified, who know that whether this drug is being dispensed, it will produce this particular effect. But those students are those persons who are not qualified. If they sit and take the job of that pharmacist, now that becomes the very important risk factor, and sometimes the consequences may be very fatal. So dispensing irrationally may be incorrect interpretation of the prescription, for giving wrong ingredients, inaccurate counting, inaccurate compounding, and labeling also. So, and sometimes the prescriber has not prescribed, but actually he needs, the patient needs. Now that is also irrational. Like I told you that under prescribing is irrational. So not prescribing is also irrational if it is to be prescribed. So the vicious cycle occurs in the form of like the doctor shows that things that my patient is needing multiple drugs. The patient thinks that my doctor has prescribed multiple drugs, so I have to take, and ultimately the cycle continues. And so rum must be used in therapeutics. But this is not this rum, what is mentioned. The rum is rational use of the medicine, that is rational use of the drug. So every time you prescribe, you dispense, just think of rum, whether the use is rational or not. So rational use of the medicine should be remembered every time, whenever it is prescribed, whenever it is dispensed. So concept of rum is that whether the patient is going to receive medication appropriate to the disease, as well as the dose, and as well as appropriate period. And the most important is, because in developing countries the cost factor becomes the limiting one, so at the affordable cost, then it becomes rational therapeutics. So rational use of the medicine is essential, use of essential medicine list, which was actually first found by the WHO in 1977. Latest is in 23. The third list has been published in 23. Indian government also has published recently, and out of this there are some of the drugs they have been added and some of the drugs they have been dropped out. So existing, and if the prescription is governed by the essential drug list drugs, the chances of the rationality becomes more than the extravagant prescription. So existing global and regional initiative on the rum, like the core competence, the use of the national and hospital essential medical list. Every hospital has the responsibility to produce its own essential medical medicine list. Every government hospital needs to have because every government hospital has a different variety of patient, and the essential medicine list of that particular government hospital or private hospital is not similar to the other one. So a government has given the first is WHO has given an essential drug list, which is globally accepted. Then Indian government has framed, so it is also accepted in the country. But to be precise, to be specific, to be more rational, we have to have our own essential medicine list. Then the chances of rational prescription, rational therapeutics will really increase. So first thing is utilization of the essential drug list compounds. Then rational prescribing. Every time you see, when I say that I am Mr. Right, means I prescribe right drug to the right patient, to the right time, to the right dose, to the right dosage form, to the right duration, and right withdrawal also. So all these rights are there. Then naturally this becomes rational. So if you can answer W and H family questions, then means you are rational. So क्यों दिया, why, what, क्या दिया, when, कब दिया, who, किसने दिया, where, किसको दिया, like that. So all these, if you can answer the questions produced by these two family, W and H, now means you are doing a rational therapeutics, and the role of the pharmacy person becomes very high. So here also the role of the pharmacy persons becomes very. So here just one word. If you write single word here, that is right. Just it becomes rational. You remove this, it becomes irrational. You write this, it becomes rational. So right person, wrong person, irrational. Right medication, wrong medication, irrational. Right dose, right time, right route, right documentation, right reason why you are giving. So all these, if you can, so at the first, in the beginning, I told you that drive in the left, right in the right, hence prescribe in the right, and dispense at the extreme right, because dispensing is more guarantee that the patient will take medicine. So because of this, the pharmacists become very important. So know the rights. So right patient diagnosis, dispensing, cost, counseling, documentation, and refusal also. That is very important. Every time I teach and every time I train that every patient is not for you. Every parcha is not for you. Everything is not for you. So if you are not able to see that what is written here, what is actually written, you are not actually comprehended with that particular writing, please refuse that you are not able to give the medicine, because refusal means incorrection. But if you have given or you have dispensed, you have administered, means the consequences are to be guaranteed that they will happen. So who appreciates and recognizes the importance of pharmacist's role? The most important body of the world, that is WHO. So WHO appreciates the role of the pharmacist at different forum at different times. So WHO prescribing indicators, they have been framed, and if you see all these indicators, if you see the role of the pharmacist is in each and every indicator, like average number of drug prescribed per encounter. Now here the role of the pharmacist is there, because pharmacist is the person who is actually who can audit all these prescriptions at his level. Then percentage of the drugs prescribed with the generic name, again the role of the pharmacist. Antibiotic prescribed, again the role of the pharmacist. Injections, role of pharmacist. Then essential drug list, whether they are from essential drug list or out from. So again the role of the pharmacist. Then average consultation time, dispensing time, actual dispense, adequately labeled, all these, they have role of pharmacist. Availability of the copy of the essential drug list and availability of the key drugs. So all these, so these WHO health facility indicators, which are actually gold standard for assessing these health facilities and all these, and the rational therapeutics. Now, in each and every sentence, you will see that there is a role of pharmacist. So at institutional level, our aim should be to have a standard treatment guidelines and to frame essential medical list, then ADR monitoring centers and active participation in the pharmacovigilance program, prescription audit, time to time, pharmacoeconomic analysis under the leadership of the pharmacist, therapeutic drug monitoring, drug information center in collaboration with the other faculty. So mortality and morbidity discussion should be there. And my message is, if you don't appreciate yourself, no other will appreciate. So my message is, love yourself and empower yourself. So if you become better, if the pharmacist becomes better in knowledge, in wisdom, in application of the knowledge, naturally the love towards the self will become more, and the respect in the society and all this will become more. So we are the first to love ourselves. So illegible writing, unclear direction, ambiguous meaning, etc. They are the biggest hurdle which has to be sorted out by the. So be aware of the Lassa drug, that is look alike and sound alike drugs. So sometimes the mistakes occur either during the time of the writing by the doctor, or the doctor has written something, but they have been actually misinterpreted by the pharmacist and sister staff and another them. So, and whenever you advise anything in the pharma, by change in the diet or change in the habit, please be specific. Otherwise, the first slide I told you that grandma and grandma means just a punctuation will make a difference. That's how we have to be very precise. And some of the time we need explaining, like eye drop become very less effective. They are not explained properly. So ultimately, the person who is actually dispensing, he has to tell how this eye drop to be applied. Because if the eye drops have been dispensed, but the application of the eye drop, nasal drop, that is not appropriate. That naturally the effect will be neutralized, or effect will be reduced, and this will be again part of the irresponsibility. The most important, I have found that aerosol prescription by the doctor, especially in the case of the bronchial asthma. Now, bronchial asthma patients, the golden drug is aerosol of the bronchodilators, but unfortunately, they take, but they don't get relief. And when we found out what is the reason, the drug is appropriate, the disease is curable or treatable, but unfortunately, why this response is not coming, then it is most of the time the aerosol is being administered, but in a wrong way. So here the role of the pharmacist and role of the sister and role of the other paramedical staff, this comes that while dispensing these aerosols to the patient, they should have a dummy, so that during the time of dispensing this, they do the demonstration of that through that dummy, so that the patient learns how the aerosol to be taken. That is very important. If you can do this, this will be a great service to the human being. Why OCP causes failure? Wonderful. Many females, they are under OCP, on OCP, but unfortunately after 3-4 months they become pregnant. Why? Because nobody told where they have to treat. Now they have to start here, but unfortunately if they start here, now when they needed actually hormone, they will have only iron. When they needed iron, they will have hormone. So there will be actually mismatch in the cycle and leads to the contraceptive failure. So this is the two things my request are in most important, because whenever aerosol is being dispensed, it should not be dispensed as such. It should be with demonstration. And the second is, whenever oral contraceptive or any pill is to be prescribed, it has to be prescribed with the proper instruction that through which direction it has to be taken and it has to be started. Then pharmacists or sisters, they are well more aware of whether the drug is to be given by the microdrip or the macrodrip. Unfortunately, if the doctor is not attentive at that particular time, then anybody has actually moral duty to rectify the things to save the life of the patient. Then the drugs are given through the transdermal patches, but they are not working. The reason is nobody told that where to actually put that transdermal patch. Transdermal patch dispensing is one part. Transdermal patching is second part, and that patch where to be applied, how to be applied, all this that should be explained to the patient. So only dispensing is not the job of the pharmacist. The explanation, the demonstration, all these things, counseling of the patient, that comes very much under the responsibility of the pharmacist. And if they play this responsibility, then they are able to actually play this responsibility. Naturally, the rational therapeutics is guaranteed. Insulin is not working. The reason is the insulin is to be administered at certain points, but unfortunately, it was being administered. Nobody told, neither the doctor nor the pharmacist, and ultimately the sufferer is the patient. He is taking insulin, but unfortunately, no effect. So sometimes these happens. So car accident happened. Why? Because a doctor prescribed a cough syrup. Cough syrup was given to the patient. Patient took cough syrup and started journey towards the home. But unfortunately, cough syrup that has sedative property and that led to the drowsiness and accident happened. So where was the fault? The fault was at the two sides. The first one was at the doctor who prescribed cough syrup without any instruction that these cough syrup, they have a tendency to produce sedation. The second and more important is during the time of dispensing, because during the time of dispensing, you have to tell that this cough syrup, please don't take this cough syrup while you are driving, number one. If you have taken this cough syrup, go by other way, don't drive by yourself. So that is how we can, by one single instruction, the life of the patient, life of the person can be saved. So here the importance of pharmacy and rational therapeutics. So just STBR lotion. Now anybody had this and thinking that it is a syrup and somebody can take. So we have to say something, and with the some instruction, with some symbols that this to be not consumed orally. And here again, there are role of the pharmacist. So all these responsibilities, they have been actually thought out, and the composition of the pharmacy and therapeutic committee has been framed. And the work of this committee is multiple. And one of the core person for this committee is pharmacist. So pharmacy therapeutic committee is for the policy making and a recommending body for the selection, procurement, dispensing, labeling, availability, administration, and control of the drug. So it increases the rational use of the drug, also increases the safety of the drug, and under this, the hospital formulary is updated. If the Mr. Wrong means the license is for the car, but unfortunately he is driving truck. Now he is likely to have accident, and this happened. Why? Because he was licensed with this, but unfortunately he drive this. Now we also have a same tendency. We get a license of allopathy, unfortunately start prescribing homeopathy or Ayurvedic, or dispensing Ayurvedic also, and then becomes very irrational. So safety is the first, and to avoid these, we have to know that whether we are authorized for that or not. If you are not authorized, please be limited to your pathy. So here the message to the pharmacy persons and as well as the prescribers, the doctors. So higher the cross practice, higher the chance of the crosses. So better avoid crosses, because avoid cross practice. Limit within the practice to which we have been trained. Use of the herbal medicine, I absolutely don't agree that this should be prescribed by the allopathic. Reason is we don't know how they will behave. So better not to do with the cross practice, because that is also a rational therapeutics. So what patient needs to know about the medicine? So patients also have right and need to know something. So what is the reason for their taking medicine? How the medicine to be taken? How the medicine will work? What benefit is expected? What adverse effects are expected? What precaution one should take? Symptoms to report, monitoring, food to avoid, and all these. So many they can be answered by the physician, and many they can be correlated or answered by the pharmacist. So here the collaborative services are there, and pharmacists are bound as well as morally bound to have ethics. Everybody in the world is bound to have ethics, but those who are professional, they become more responsible. They are more bound. So ethical principle of the pharmacists are, as usual, the pharmacists should respect the professional relationship with the patient and act with the honesty, value and dignity of the patient, make personal choice about the pharmacy care, then patient and activity support the patient right to receive the competent and ethical care. Pharmacists protect the patient right of confidentiality, never breach the confidentiality of anyone. Then other health professional, if you have anything, we can have a correlation with the other health professional, including the knowledge sharing. Pharmacists endeavors to ensure that practice environment contributes to the safe and effective pharmacy care. So all these are ethical principles. These are general principles which are actually related to anybody in the world. But those who become professional, now they are having, because of their professional responsibility, they are expected that they will have to have these ethical principles in spirit and then there are certain competencies which are expected of the pharmacist, and most important competency is that safe and rational use of the medicine and the medical devices. So here, if you see here that they are not dispenser only. So that is why I am always focusing that pharmacist doesn't mean that dispenser. Pharmacist means a bridge. A bridge cannot allow only one vehicle. Bridge allows multiple vehicles, and because of that, the pharmacist has to work multiple tasks. Maybe patient consultation, patient management, pharmacovigilance, therapeutic outcome, anything right from the beginning. Even some of the advanced countries, they have pharmacists which will take proper history, then only and he will write the proper history, especially the patient who are on certain medicine, that medication history and all this, and hypersensitivity history, etc., properly written over the pad, then only he will be taken to the consultant. So likewise, so not only after the prescription is written, the duty of the pharmacist comes. No, it starts from the beginning. And second is not the pharmacovigilance and all, therapeutic drug monitoring, etc., our quality record keeping and all. So they are all a role of pharmacists. So that's how the competencies they have been actually given for a pharmacist in the field of like public domain, safety, supply of the medicine, organization, professional and personal practices, etc. And there is a lot more to your story. So your role is in OPD pharmacy, your role is in inpatient, emergency, pharmacy supply management, drug information unit, clinical pharmacy services, and making ABN and BEN analysis. So I must, I suppose that you are aware of ABN and BEN analysis, but I'll tell what is ABN. Now ABN is there are three categories of drugs. Some drugs, they are very, they take most of the part of the allocation of the funds, but unfortunately their quantity remains only less. Second are medium, and the third are which are least expensive, but they are actually required in the most quantity. So that is, and in collaboration with that particular committee, they will have a list of category A drug, category B drug, category C drug, and allocation of the funds to category A, category B, and category C. And accordingly, the drugs will be purchased, and they will be actually kept for the And the second analysis is when analysis, that is vital, essential, and non-essential. Some drugs are vital, they like emergency drugs, they are vital, they have to be there. They atropine, adrenaline, no chance that they are not in the emergency. Then there are certain drugs which are essential, and some drugs that like maybe not non-essential, or they can be delayed, or they can be ignored. So like also we have to make three lists: vital drugs, essential and non-essential. Focus over the vital. Vital you cannot ignore. Vital cannot be compromised. If don't have fund, can compromise with the non-essential, but we have vital. So that is how we here the responsibility of the pharmacist comes to make these two lists. One is ADC analysis and the another is EN analysis. So know your pharmacist in your place where you are sitting, where maybe in your hospital, maybe in your dispensing, maybe anywhere. Please write this quotation that your pharmacist, know your pharmacist, because they must know they are knowing doctor, but they should also know the pharmacist, because half of the part is done by the pharmacist also. So just you say that, did you know that we are the vital link in the system of therapeutics, and we are much more than a mere medicine seller or dispenser. And that's how, because I have told that we have to praise, we have to love ourselves. And if we say that this is there, naturally the patients also think that only writing prescription of the doctor is not the treatment. The treatment is over only with the help of collaboration of these team members. And there should be do's and don'ts of your medicine. So these can be actually utilized. These posters can be, or these boards can be kept, so that the patient, if they have any query, they can contact, provided the pharmacist is qualified. Because if you write this and the patient starts questioning, and then you have to actually answer also. So for answering, we have to have knowledge also. So that's how a knowledgeable professional pharmacist should show that, okay, I am your pharmacist, and you can take my help for these particular things. Spend some time with the pharmacy. Don't be hurried, because most often it has been seen the patients are sitting for 4 hours, 5 hours to show the doctor, but they don't have patience for 4 minutes to go and stand in front of the medical store. Now that is very bad. Now sometimes what happens, if they make hurry, now if the dispensing is in hurry, may be the chance that the dispensing is with error. And to reduce this, they should be told that please don't force, and this should, and the pharmacist should also be very pertinent, not to be in hurry and not to be under any force. And always say to patient that please, I have given this, and these are the instructions. Anything you want, again, please ask and check your medicine and all the things. So check them, and before leaving the patient, always think that, see that whether the right has been covered or not. If the right has been covered, means you are a rational pharmacist and doing rational therapeutics. So take home messages are like, rational therapeutics is a complex but achievable task. Medically inappropriate and economically insufficient use of pharmacotherapy is a common occurrence. Rational prescribing for the appropriate treatment of the monitoring. Pharmacists play the most crucial role in the rational therapeutics. Pharmacy professionals play a very pertinent and key role in reducing the medical errors. And RAM, I have told, RAM, that is a rational use of the medicine or rational use of the drug. And pharmacists are the ideal position because they are the bridge. So doctors have only a snapshot of the patient, whereas the pharmacists, they have a time to have interaction with the patient, and they can explain in a better way, in a more transparent way to the patient regarding what is the drug, how it is to be taken, what will happen if this, and what if the adverse event occurs. So all these they can be told by the pharmacist. The irrepressible bridge, I have already started my lecture with this particular bridge, and dispensing is not the only task of pharmacist. So this myth should be broken, and then only the rational importance of the pharmacist in the rest of the therapeutics will be shown. So trained and educated pharmacists are need, not the hour. And once told that ultimate goal of the service of the pharmacy is rational and safe use of the medicine by the public. So if a rational prescription has been written, but unfortunately it has been dispensed irrationally, the purpose of the rational therapeutics is lost. So everything should be in the rational, and rational is nothing but with a reason. If you can answer W and S family, then it's rational without any confusion. So whenever you dispense, please give an answer to yourself. Can I dispense? Means whether the drug is contraindicated or not, or the cost is excessive, disproportionate to the patient. Indication, whether it is indicated or not, interaction, some drug interaction one should be aware of, important. Then identity of the patient. The same prescription to be dispensed to the person who has actually produced that particular prescription, not the different one. Drug dose, duration, direction to the patient, etc. So it is impossible to imagine a world without doctor. But more than that, it is impossible to imagine a medicine without pharmacists. So medicines are nothing in themselves but the nectar if employed rationally. So thank you very much for your patience listening, and any confusion, any comment, most welcome. And fortunately, it's unfortunately, so sorry, tomorrow is Monday. So you will have to go to the work. Thank you. Thank you very much.
Thank you so much, respected sir, for such a wonderful session on role of pharmacist in rational therapeutics. You have wonderfully explained how the how rational prescribing can be done, regarding the irrational use of the drugs, regarding the same sounding drugs, writing error, prescription error, explained about the right administration of the medications, safe use of the medicines and medical devices, how pharmacists can play a role in patient counseling and medication history of the can take the medication history of the patient. Clinical data management can be done by the pharmacist, and after prescription the role is of the pharmacist only, and he has to play the big role to serve the community, to serve the patient. Thank you so much, sir. Sir, I want to ask some questions which we have taken from the participants.
Yes, yes.
So the first question is CME compulsory to compulsory to continue the pharmacist registration?
Pardon?
Continual medical education is compulsory to continue the pharmacist registration
Yes, anybody who is a professional needs continuous training to upgrade his skills and knowledge. So whether anybody is doctor, pharmacist, anyone, he has to go with the rigorous training, and whenever gets chance to learn something new or something better, never miss this chance. And regarding the mandatory, so when you think that it is your responsibility, automatically it looks like mandatory.
Right, sir. Right, sir. Thank you so much, sir. Sir, the second question the participants have asked is how medication error can be avoided? What all precautions should be taken to avoid the medication error?
Okay, wonderful, wonderful, wonderful. So first of all, my suggestion is please have patience with the patient. The message is never lose your patience, number one. Because if you are in hurry, naturally you are going to some damage. Either in the form of wrong dispensing or wrong advice or wrong person. You have given wrong. Many cases have happened. The medicine has been dispensed to the wrong person. So first is have patience with the patients. Number one. Number two, if confusion, stop. if you are in confusion that whether I have to move right side, left side, better don't.
Excuse me, sir, your sound is not audible, sir.
It will not be good. So that's how one should be. And third is be cautious.
Sorry, sir, your sound is not audible.
Pardon.
Yes.
Hello.
Okay, okay, sir. It's
Hello.
audible now. Right, sir?
Is it coming?
Yes,
Okay.
sir. Audible.
So, okay. So the message is that whenever in confusion, please, if you are not able to read the writing of the doctor, it is better to refuse the dispensing rather than dispensing the wrong medicine. Number two, as far as possible, if you are in the practice of giving medicine, as far as possible, never mix the injections. So, and never try to be with the FDCs. अब कभी अपनी तरफ से FDC का नहीं देना है कि मान लीजिए there are two drugs which have been prescribed by the drug by the prescription by the doctor, and you have the FDC containing both drugs. Please don't, because this is a bad habit. Because the separate drugs have been prescribed. The reason was something, because they cannot be given simultaneously. And
Right.
if you give both the drugs, then it will be not rational. So that's how very common sense they can be. By you applying the common sense and the basic pharmacology, we can reduce pharmacological therapeutic errors and dispensing errors.
Right, sir. Thank you so much, sir. Thank you. So on behalf of our SPSR organizing committee and all the participants, I would like to express our heartfelt gratitude to Dr. Rakesh Kumar Dixit, sir, for gracing us with invaluable insights during today's webinar on Pharmacist, a proactive positive player in rational therapeutics. Dr. Dixit, your expertise and knowledge have illuminated the importance of pharmacists in rational therapeutics, and your dedication to the field is truly commendable. Your contribution today will undoubtedly leave a lasting impact on our understanding and practice in this critical area of healthcare. I would also like to extend our sincere thanks to Dr. Shashi Alok sir and Mrs. Monica Sabarwal madam, National Secretary SPSR, for their support and guidance in organizing this webinar. Their commitment to the success of this event has been instrumental. We extend our gratitude to Dr. Sanjay Nagdev sir, the co-convener and the member of SPSR, including Dr. Saurabh Kose sir and Mr. Ankur Agrawal sir, for their invaluable contributions and support throughout the planning and execution of this webinar. Thank you, Dr. Rakesh Kumar Dixit sir, for your enlightening presentation, and thank you to all our distinguished guests and participants for joining us today. We look forward to much more enlightening session in the future. Thank you and have a wonderful day. Thank you so much.
Thank you.
Yes, thank you, sir.
डिस्कनेक्ट कर दें?
हाँ सर, आप उसको करिए सर।
जी सर।
ठीक।